Good afternoon, and happy Monday. I apologize, we're a few minutes late. The President and Vice President and CDC had a call with all of the governors, which ran over, and I felt it was important to stay on till the end of the call. But I'm pleased to be here today to kick off our week together. I'll be here every day this week at 1 o'clock, with one exception. On Wednesday, it will be at 2:30, and then every day at 1 o'clock except Wednesday, switching the time to 2:30. I'll begin, as I always do, by drawing your attention to the numbers on the screen. You will see that, unfortunately, there was an uptick yesterday in our number of cases. I don't think it's anything to be alarmed about. We're continuing to increase our testing. We know we're still in the part of the curve where we're on the incline, not the decline. So it's consistent with what we've been seeing, and certainly nothing to be alarmed about. Also, I would say that what we do know is that we have flattened the curve, slowed the curve, and brought down the peak, which is all fantastic news and a great relief and a great credit to the people of Rhode Island. So thank you all, to businesses and individuals and teachers and parents and everybody who's been doing their best. It's clearly working. As I say, I just got off of the phone with all 50 governors, and we each reported in, and we are doing as well, if not better, than other states around the country, and I just want to thank everybody for their cooperation. Today I wanted to focus the majority of my comments on the work that we've been doing to safely reopen the economy. Each day over the past week, I've been providing a little bit of an update on our work streams as it relates to testing and contact tracing, food delivery, quarantining, etc. And today I wanted to let you into some of the work that's happening in our work stream that we call the new normal. We know that even when we get back to business and go back to school and we come out of our homes, which I hope will be soon, we know it's not going to be the way it was. It's until we have a vaccine, which is about a year away, we're going to be living under a new set of circumstances. We're not going to be able to congregate in large crowds. We're not going to be able to do business the way we used to, but we are going to be able to get back to business, and that is, I think, so important for all the obvious reasons. And I wanted to give you a sense of how I'm thinking about it. I will say I've spent every day of the past 6 years working to improve our economy, and as we came into this crisis, we have one of the lowest unemployment rate our state's ever had. So it's been devastating for all of us to have to clamp down on the economy. As I've done this, my approach has been to be targeted, to maintain a semblance of the economy the whole time, but also, first and foremost, protect the lives of Rhode Islanders. And some of the decisions I've made have been different than other states. For example, in Massachusetts, they've really clamped down on manufacturing. I chose to allow manufacturers to continue, and by and large, that seems to have been a good decision. Many of our manufacturers have stayed open under very different circumstances to protect employees and Rhode Islanders, and very reduced schedules, but we've maintained some of those jobs, and I want to thank the manufacturers for your cooperation. As I go forward, I'll continue to do that. I want as many people working at all times as is safely possible. Unfortunately, we face some headwinds. Every state is differently positioned in this, and Rhode Island faces some headwinds. I think we're the most densely populated state in the country, either number 1 or number 2. That makes it harder. This is a virus where you don't want to be close to people. We have a very high concentration of seniors, and we love every one of our seniors, but we know that folks who are older, over 70, over 80, are the most at risk with this disease. So as we reopen, we have to be extra vigilant to protect our seniors. We know, if you look across the country, the groups that have been hardest hit are small businesses. particularly businesses with fewer than 10 people. If you look all across America, those are the ones that are the hardest hit. Well, for better or for worse, in our economy, Rhode Island's economy is chock full of small businesses. The backbone of our economy are these small businesses, including the very smallest, 10 and fewer. These are the businesses that they're not tech-enabled, they're not necessarily able to easily work remotely, and so it's harder. It's going to be harder for them to reopen, and it means we're going to have to work harder. We also know, if you look all across the country, unfortunately, the people who are hardest hit are those who are the lowest skilled with lower education levels. By and large, folks who only have a high school degree are getting hit the hardest. And again, unfortunately, here in Rhode Island, we have lots of individuals who don't have a degree past high school or who work in a low-skill, low-wage business, and so that's another headwind. Tourism is an important part of our economy. Tourism has been really hit hard across America, and we will feel that doubly so here. So, what does that mean? It means, we're going to get this done. We're going to get it done together. We're going to get everybody back to work. But we need to be honest that we face some headwinds that some other states don't have. When I became governor, when I was elected, we had the highest unemployment rate in the country. And for me, this now was a little bit reminiscent of that. I remember when I started, unemployment rate in certain industries, like the building trades, was 20–25%. And at that time, as your governor, I said to you, we would rebuild this economy together without leaving people behind. And I said then it would be a tall hill to climb, and we would climb it together. And we did. In the course of the 5 or 6 years from that, we went from the highest unemployment rate in the country to the lowest unemployment rate our state has ever seen. And in those industries that had a 25% unemployment rate, we brought them down to a 2% unemployment rate. So what does it mean? It means we got to do it again. And it's not going to take nearly as long this time. We're going to stand our economy back up together. We did it before, and we're going to do it again. And this time we're going to do it a whole lot faster because all of the building blocks are in place. But it's going to require us to be brave. And when I say it's time for us to get back to work, we're all going to have to be brave, even though we're going to be anxious and afraid to go to work or go out to eat or, get our hair done. We're going to have to do it. Confident that the state will have the measures in place to keep us safe. And as I've said all along, we're not going to do it overnight. This is going to be a gradual process based on facts and science, an industry at a time, with different new regulations. Right now we're living in a world of no groups of more than 5 in any one place. We're not going to go from 5 to 50 overnight. We're certainly not going to go from 5 to 100 overnight. That's going to take a long time. But we're going to get there, and we're going to go as fast as is safely possible. And for me, I'm going to have to be flexible, and I'm going to ask you to be patient as I change my mind, which might be necessary in light of new facts and new information. But I want you to know that my goal will always be get as many people to work as fast as is safely possible. Now, before we begin, right now, the stay-at-home order is in place until May 8th. So we're not doing anything until before May 8th. It is really my hope that between now and May 8th, we start to see a decline in the rate of infection so that shortly thereafter, May 8th, we can start to loosen some of these restrictions. That I would love to be able to do that. So let me take you through the questions that we're going to ask before we tell you that it's safe to start going back to work. The first question is, has the rate of spread of the disease continued to decrease? So, in other words, does the data indicate that our social distancing has been effective enough and we're starting to see a decline in cases, not an increase in cases? Secondly, do we have the capacity to quickly identify community spread on an ongoing basis before a major outbreak occurs? So we've been working very hard on our testing and contact tracing, and before I say we can reopen, I need to have confidence that we can do enough tests per day in every population. We have adequate contact tracing so that we can quickly pinpoint a problem going forward. Third thing is, do we have the necessary supports in place for vulnerable populations and for anyone in quarantine? So older Rhode Islanders and people with pre-existing conditions are going to have to stay home longer. Those of us who are healthy and younger will obviously be able to go out and get back to normal sooner than vulnerable populations. So when it gets to be the time that I roll out new regulations, they're going to be different for people who are seniors than people who are younger. And that's just because we need to keep everyone safe. It's also important that we know we have the infrastructure built so we can take care of you if you are isolated or in quarantine. So you can get your groceries, get your medicine, get checked in on, have your symptoms tracked. We're making huge progress every day on that, but we're not quite there yet. And if you go on RI Delivers, which is the website where you can find food delivery, you'll see we still don't have quite enough capacity to meet the supply, to meet the demand. So we're going to keep working on that over the next few weeks. Fourth question is, does our healthcare system have the capacity and the PPE to handle future surges? So when we start to let folks go back to work, it is very possible that we'll start to see an uptick in the number of cases. What we cannot have happen is to see a surge that overwhelms our healthcare system. We have more PPE. We're trying to get to a place where we have 30-day supply on hand at any given time. We're not quite there yet. We want to have enough surgical masks so critical infrastructure workers can have surgical masks when they go back to work. And we have to make sure we have enough hospital beds and ventilators in the event that we see an increase. We're working on that. Fifth thing, do businesses, schools, child care facilities, faith leaders, and recreational spaces have plans for long-term social distancing? So for the past month, we've been working very closely with private industry, and we will continue to stay in close contact in the coming weeks. But I'm also going to be asking for very detailed plans from child care centers, colleges, universities, churches, faith groups, et cetera, to make sure that they are all prepared with their own plans in place to maintain social distancing for the long haul, for the next year, in stages, the same way we are going to be in stages. Sixth factor is, are we prepared to reimpose measures or reclose certain sectors of the economy if it becomes necessary? Now, this I want to be very clear about. We never again want to be in a position where I need to do what we've just lived through, what we're living through now, which is a complete shutdown across the board rapidly. I can't promise we won't need that, by the way. If in a month or two we start climbing up the curve, then we will do that. But that's not the goal. The goal is, the reason we're putting in place all this testing, we want to start moving to the antibody testing, is because we want to be able to pinpoint a problem in the future, and if we have to throttle back the economy or do any more closures, it'll be more of a pinpointed closure, maybe just a particular business or a particular kind of business or a particular region or et cetera. And so that I think is quite likely to happen after we reopen. The reason I think that is because that's what you're seeing all over the world. So Singapore was way ahead of it when it came to testing and contact tracing. They came back a little too quickly. They saw a surge. They had to clamp down. Hong Kong, same thing. They were doing pretty well. They let college students come back probably before they were ready, or I don't know, maybe not under great circumstances. They saw an increase. They had to clamp back. The goal is that we'll be able to, if we need to throttle back, do it in a more pinpointed way. And so that's why before I can do anything, before I can start to say we're going to go back to work, we no longer have to stay at home, we have to be really sure that our quarantining, isolation, testing, contact tracing is in an excellent place so that we can pinpoint any future closures so we don't have, again, an outbreak. Last thing I'll say is this. Right now, there's no vaccine, and there's really no therapy. You know, there's some potential therapies. There are researchers working hard on a therapy or a cocktail of therapies. Even right here in Rhode Island, we have excellent researchers at Lifespan who are working on this. Obviously, if in the coming months there's a medical breakthrough on a therapy that's effective or on a vaccine, well, then that's different. Then we can start to take more risk because we'll feel more comfortable. But in the absence of a therapy or a vaccine, we're going to have to take it slow because, frankly, we can't take the risk of being where we were a few weeks ago. I have been getting asked a lot how our plans compare to what the White House released last week. President Trump and his administration and the CDC put guidelines out at the end of last week for states, and many people are saying, hey, what does Rhode Island think about those? So I thought I would address that directly. The White House calls for a phased approach, phase 1, phase 2, to reopening the economy. And I support that, and we will also be taking a phased approach. We here in Rhode Island are going to be looking at an industry by industry, setting by setting, sector by sector approach, and that is consistent with the White House's approach, only more detailed. And every governor will have to make those decisions based upon their own economy and the kinds of jobs in their economy. The White House and the CDC also call for a downward trajectory of flu-like symptoms and a downward trajectory of positive COVID cases for 14 days. So the White House and the CDC suggest you need to see a decline in cases for 14 days consistently before you can even enter phase 1 of reentry. And our approach is very similar. We support that. We are looking for creative ways to collect symptom information. You know, the testing, we have testing. We're some of the best in America for the number of tests we're doing. We can track number of cases. We're trying to figure out creative ways to track symptoms, so we also have a sense of knowing whether our symptoms are on the decline. Unfortunately, right now, our positive cases are still on the incline, as you can see from the information on your screen, but that's going to change. It will change because social distancing is working, and we will get to a point where we see a decline in symptoms and a decline in cases. The White House guidelines also call for ensuring that hospitals have the capacity to treat everyone without needing to implement crisis care procedures and ensuring enough testing is in place for at-risk healthcare workers. We fully agree with this. You know, Rhode Island is, you've heard me day after day talk about both of these. Right now, we're treating all patients without crisis care standards, and we hope that that continues to be the case. And we are working very closely every day with our hospitals, monitoring their capacity. We've set up a great system with the hospitals where we get a daily information around where they are in their capacity, around beds, ICU beds, ventilators, and PPE. And we're going to keep that going and make sure that we always have what we need. The White House is also looking at many of the same indicators that we are. They say testing and contact tracing. The call that I was just on with the White House and the governors focused heavily on testing, and we are very much aligned with them with respect to that. So I would say overall, the approach that Washington is recommending is consistent with the one that we'll be taking, a phased approach, don't begin before you're ready, and make sure that your system is ready for a reopening. The only difference, if there is a difference, is just we obviously are going to have much more detail, and every state will have to, and I think it was appropriate for the president to suggest to the governors that we're the ones that have to make those decisions in our communities with our stakeholders. I will say this, two other things. I have joined a coalition with a handful of other governors in the Northeast. I'm going to do my very best to coordinate and collaborate with them, all of them. We share a lot of commerce on the Route 95 corridor, so it'll be very important that we have similar approaches. It's particularly important in some ways that we collaborate with Massachusetts. We share many large employers, Fidelity, CVS, Hasbro, Bank of America, Citizens, many other companies. So those companies are going to be looking for similar guidance from both Governor Baker and I, and so we're going to do our very best to coordinate our approach. I do know this. We're going to do this. No one's ever done it before. We are together going through something that no one's ever done before. We are living a global pandemic. We've had to shut down the economy together, and we're going to stand it up together, and we're going to get it done. It should give you some confidence that Rhode Island, if you look across America now, Rhode Island is more than holding its own. We have more testing per capita than almost any place. Our healthcare system is being very well coordinated, and we have an excellent surge plan. We have a field hospital nearly ready to use, was built in record time. PPE is not perfect, and frankly not where I want it to be, but not terrible and getting better every day. And just look at the results. I mean, the results of every case is sad, and every death is tragic. But if you look at where we are today versus where we could have been if we didn't take swift, targeted action, it should give you some confidence, great confidence, that our team has a good approach. The results are there. And as in the months to come, we are all going to have to endure a certain amount of continued frustration and impatience, because it won't be fast enough for any of us, including me. But I predict that 4, 6, 9 months from now, when we are back to work a bit more and living our lives a bit more, you will be able to see that Rhode Island has stayed at the cutting edge of what we're doing. And that's our goal. And every time we'll make a mistake, we'll admit it and we'll change. We'll be flexible, we'll be fact-based, and we're going to get you back to work as soon as we can. And in the meantime, we're going to keep you safe. We're going to do everything in our power to make sure we don't have another huge spike. And we're going to make sure that if you have to stay home or if you're in a vulnerable population, we're going to work overtime to keep you safe and have your needs met. So and by the way, every day this week or most days this week and next week, I will be coming back with more detailed information. We are committed to a very inclusive approach as to how we reopen the economy. I want to give a huge shout out to Commerce Secretary Stephen Pryor and his entire team. They've been working overtime to stay in touch with businesses, and we're going to do that. Yesterday I was asked a question about hairdressers. We don't know exactly when hairdressers can come back. It's a close contact business. We don't know the regulations, but I do know this. We're not going to do anything without consulting with hairdressers who are in the business. And I promise you that. And the same for manufacturers, and the same for retail operations, the same for small companies and big companies. We're going to have an inclusive dialogue, as we have been having, and together we're going to figure it out. And we're going to do everything we can to keep people safe. Okay, a couple of other quick topics. I have some good news to share as it relates to SNAP benefits. One of the very unfortunate realities of what we're living through is people are food insecure, and some kids are food insecure, and people who were food insecure when we started this are even worse off. So we're constantly asking ourselves, what more can we do? How can we meet the needs? Last week, I'm pleased to let you know that last week, the USDA Food and Nutrition Service gave approval for the Department of Human Services to issue additional support to the families of nearly 73,000 Rhode Island students who rely heavily on school meals. So, the sad reality is that for many kids in Rhode Island, they get their meals in school. That's the only way they get a decent meal or two a day. And when I had to close schools, it really weighed heavily on me because I knew many of these kids would struggle not only to get an education, but to find a meal. And I want to thank municipalities and municipal leaders and schools around the state who have worked very hard to provide meals for kids, but still it's a struggle. So I want you to know that the new pandemic Ebt Benefits will give parents with school-age children who receive free or reduced meals $5.70 for each child for each day school is closed, retroactive to March 16th, which is when distance learning began in Rhode Island. So that's about $200 per child so far. For households where our DHS was able to match the child's name to a current SNAP case, they'll receive the March and April benefits today on their existing EBT card. All other eligible families will receive a new card by May 1st, and funds will be preloaded onto those cards that you receive on May 1st. For current SNAP families, if you don't see the benefit today, please wait to see if you get a new card in the mail by May 1st with the money on it before you contact DHS. Some families may receive the card because their child goes to a school in a community eligible district where breakfast and lunch is served at no cost to all enrolled students. So that would be, say, Providence. If you receive the benefit and you don't need it, or you don't want it, you don't want to use it, you can just destroy the card. If you destroy the card, the money will be returned to the federal government. So I hope that was clear. Director Courtney Hawkins is an amazing leader, and she'll be communicating more directly. But the bottom line is we petitioned the federal government for extra SNAP benefits. Rhode Island was the second state behind Michigan to have this approved. If for many of you today, there'll be additional monies loaded on your EBT card, extra money for each child that you have. If you don't receive the money today, wait until May 1st. You're going to get a separate card just with the extra money. Certain cities, Providence being one of them, due to the federal government's rules, the entire population is eligible. That's a decision out of our control. So if you receive a card and you don't need it, I would ask you, we are being asked by the federal government just to have you destroy it, and the money will be remitted to the federal government. So thank you to Courtney Hawkins for your hard work on that, and best wishes as you administer what is a good thing, but will no doubt be a bit of a challenge to administer. So now I'll turn it over to Dr. Nicole.
Thank you, Governor. Good afternoon. As the Governor said, and as is visible with the data on the data dashboard on the Rhode Island Department of Health's website, we have 339 new cases in Rhode Island. We also sadly have 5 additional fatalities to report. Of these people, 1 person was in their 60s, 1 person was in their 80s, and 3 people were in their 90s. I do want to extend our condolences to the families that are involved. So to continue forward, this information on our new case count, our number of fatalities, and information on hospitalizations is all on the data dashboard. We are working continually to build out this data page to present you with as much information as possible. And I want to again thank the frontline workers with our data team who work 7 days a week to get you clean, accurate, timely data that's available for the public as well as for us to be able to make the important science-driven and evidence-based policy decisions that need to be made. For example, we now have more aggregate demographic information online about the people who have or who have had COVID-19. If you go online, you're able to see that the majority of those who are hospitalized with COVID-19 are in their 60s, while the majority of people who have unfortunately passed away with COVID-19 were in their 80s. You can also look at the gender breakdowns for cases, hospitalizations, and fatalities. I also want to share today the update that we have posted on race and ethnicity data. This has been a critical point that people have worked really hard to get us towards. I said that we would be sharing more comprehensively the information that we have, and we now have the breakdown by race and ethnicity according to cases, hospitalizations, and fatalities. As we have been saying for a few days now, we are seeing the most cases among people who are Latino. Of the people who test positive and for whom we have race and ethnicity data, 45% have been identified as Latino. This is despite the fact that around 15% of Rhode Islanders as a whole identify as Latino. And similarly, we know that roughly 12% of our positive cases are among people who are African American, non-Hispanic. And they represent closer to 6% of Rhode Islanders in the state as a whole. So why are we seeing this? We're continuing to look at this a little bit more closely each and every day, getting more into the details so that we can better understand. And even with time, we know that there is not going to be just one answer about why this is occurring here in Rhode Island and nationally. There are a number of factors that are likely in play. One of these factors could be the makeup of our critical workforce. We've talked about our healthcare workers a lot as key members of our critical workforce. There are also people in many other fields who are out there working every day. That includes people who are not licensed healthcare providers, but who also do work in hospitals and other healthcare facilities, helping to sustain the work that gets done in those facilities. And it also includes people who work in food processing plants and in other elements of the food industry, as well as in warehouses and in manufacturing facilities. These people are going to work every day because we need them. We depend on them. As a society, we are learning a lot of lessons from this pandemic. My hope is that one we will all learn and remember is the criticality of the work of the people who are going in every day in Rhode Island. While being out and continuing to work every day could be putting some people at greater risk, there are more long-standing structural issues that may also be affecting the rates of illnesses that we are seeing higher in certain communities compared to in others. We know that 80% of our health outcomes are determined by factors at the community level. Most of those factors occur outside of the medical setting or the examination room that I can say as a physician. 80% of what makes people healthy happens outside of what actually happens in the examination room. I often refer to these factors as socioeconomic and environmental determinants of health. They include things like the stability of our housing and whether or not someone earns a living wage. I've spoken previously about other living conditions that someone is subject to within the environment that they're in. These factors impact someone's health and can make them more vulnerable to something like COVID-19. And given the strength that they demonstrate, the courage and the bravery that they demonstrate, they are also more resilient in the face of things like COVID-19. And of course, these factors also have a tremendous impact on people in moments at a time like this when people are already trying to make ends meet and are getting squeezed even more. We're taking a number of steps to address the disparities that we are seeing when it comes to COVID-19. I'm going to share some of them and acknowledge that there is much more that we need to do and are planning to do. We are engaging community stakeholders in helping to identify and implement targeted messaging strategies to our higher risk populations, as the governor highlighted yesterday. I've also referenced in the past our health equity zones. These are our community-led partners who have been our eyes and ears on the front lines to help us understand the impact of the COVID-19 response and the policies at the neighborhood and community level. How is this playing out in the various communities throughout Rhode Island? We are also adjusting our contact tracing approach to make sure that our language capacities meet the needs of Rhode Islanders so that everyone has access to the testing capabilities as well as the guidance for contact tracing, isolation, and quarantining. Another approach we're taking is to strategically align our testing resources with trusted and existing systems that are embedded in communities. Healthcare systems, community-based organizations, our health equity zones, partners, and many more, so that we can best address those who are most significantly impacted. And finally, we are joining with our Commission for Health Advocacy and Equity to address the disparate impacts of COVID-19. This Commission for Health Advocacy and Equity was legislatively established with the mission to help the state monitor and respond to health disparities and promote health equity. The Commission's recently released legislative report and statewide health equity measures are helpful for us in times just like this so that we can understand what impacts our health and who and where our most vulnerable Rhode Islanders are. These statewide health equity measures are available online at health.ri.gov/data/health equity. The Commission has been leaders with its members as they have connected to the community so that we can and will be able to provide the resources needed so that we can address and shape our response to work to reopen the state and rebuild the economy in a way that is inclusive of all communities. I know the governor's committed to this, Secretary Pryor is committed to this, and we join with the Commission for Health Advocacy and Equity that's going to support us with this as well. Finally, I want to add one separate note on data. We have received some feedback that some people who have vision impairments have not been able to see the screen as well during these press conferences. In response, the governor's office has created 2 phone lines, one in English and one in Spanish, that people can call to have this information read to them via a pre-recorded voicemail. The number for that information to hear in English is 401-222-8280. And the number to hear the information in Spanish is 401-222-2385. These will continue to be updated every day by 1 p.m., and this information will also be available on our COVID-19 hotline, which number we have shared previously, 401-222-8022. With that, I'm going to give it back to the governor so we can get started with questions. Thank you.
Thank you.
Good afternoon. Hello.
We begin today with a question from NBC 10 News. What do you think of Vice President Pence saying yesterday that Rhode Island is past the peak?
Yeah, I didn't see that. That's the first I'm hearing of that, so I don't know what he referred to. That's clearly not true, and I don't say that out of disrespect because I didn't hear his comment. But, I mean, clearly there is many more cases today than yesterday, and we're still on an upward trajectory. So I'd have to figure out what he said and what he meant.
Next message is from Bill Bartholomew. He says, Governor, there is a Facebook group with nearly 3,000 members seeking to end excessive quarantine in Rhode Island, and some municipal leaders calling for expedited restart to economy. What is your message to these folks?
Yeah, so first of all, I would say I can see why you would be saying that. Maybe you're out of work, maybe you're frustrated, maybe it just doesn't seem necessary to you. And, I hear you. And there are some days that I wish I could just flip the switch and let everybody go back. To the municipal leaders, they should just call me directly. I haven't heard from anyone who has said that, but obviously they all know how to find me. The facts are this. We just have to stay focused on the facts. You can see so clearly from the experience of other states and other countries that when they took the foot off the gas from social distancing too soon, they just get right back into trouble. And we've worked too hard for too long and too much sacrifice to take that risk. So I'm going to do this in the best way that I know how, which is every day evaluating where we are. I laid out a few minutes ago a clear set of things that we're looking at. Where are we with PPE? Where are we with hospitals? Where are we with industry by industry regulations? Where are we, with our contact tracing? And when we're ready, I'm not going to hold us back 1 second more than is necessary. But I'm also not going to let us get into trouble again, because then we'll be right back in the soup, and I think that would be the worst possible thing for all of us.
Tara Granahan says Saturday you said your data on distance learning is different from what teachers and administrators are saying publicly. What does your data show, and more specifically, what is the percentage of those learning, struggling, or not engaging?
Mm-hmm. So actually what publicly is being made available and we're hearing from superintendents and teachers is totally consistent with what I shared. It's why I shared it. This isn't me telling you, it's what they're telling us. We are seeing attendance rates of 90+%, in some places 98% plus. We are seeing the vast majority of students engaging. Obviously, there are students who are struggling, and there are students with special needs are struggling more. It's hard. In a traditional school environment, it's doubly hard if you can't be with your teacher. So, as I've said from the beginning, this is a not perfect solution. There are many states who have just closed school, totally, and I'm not willing to do that. I didn't want to throw in the towel. I am not going to throw in the towel. I am not saying this is as good as school in person, but what I am saying is 90+% of kids are showing up for school. Most are doing their work. Teachers are reporting that they're actually pleasantly surprised. I had a call last week with teachers and another call with superintendents. They were all reporting that it's going better than they would have thought. So in a highly imperfect world, in general, I think it's going quite well. By the way, huge credit to teachers, superintendents, principals, parents, and students themselves for sticking with it and doing their best to learn.
Brian Crandall from NBC 10 has a 3-part question. Do you expect more widespread testing of people who are asymptomatic? If so, when? Can all healthcare workers, including nursing home workers, be tested at some point?
Thank you for that question, Brian. It allows me to reiterate the importance of really focusing the expanded testing that we've done on people who have symptoms. That is when we get the best and most accurate result from the test. And we want to minimize the number of times that we have someone without symptoms who is tested that then has a result that reports negative and thinks that they are fine, but may be at risk of spreading because it was a false negative. So for the general public, it's important to continue to focus our testing on people who have symptoms. There are specific situations in our congregate settings, in some of our healthcare facilities, in our group homes, and homeless shelters where there is risk of significant clusters of cases that could lead to concerning outcomes as well as an overwhelming of the healthcare system. In those specific situations, we are taking a very targeted approach on how we are responding to that, which does include, with our oversight and close interpretation, testing of all of the workers who are involved when it's appropriate. That may mean that we are testing people without symptoms, but that's why our oversight is needed, because we can then provide the guidance on how to interpret when a test result returns negative versus when a test result returns positive, because we cannot rely the same on that if we are engaging people who do not have symptoms. Similar to what I shared in terms of our expanded nursing home approach and being comprehensive, we're also doing that in any of our congregate settings, our group homes, many of the facilities that are out there with people that are close together. We are aggressive in ensuring that we not only are testing the workers who are involved, particularly where there are clusters of cases, but then also repeating that testing where we need to really help focus our response where we know we have to do more to help control the situation at hand. So that's an extended answer to that question.
Thank you. Next question is for the governor from Jim Hummel of the Hummel Report. He says, Governor, I understand that you have heard from some pediatricians in Rhode Island concerned that their patients are having problems, not necessarily academic, but emotional and psychological because they are out of school. How does that factor into your decision about potentially reopening schools?
Thank you for the question, Jim. Look, it weighs on me and it weighs in the decision. I would like to take a second to remind everybody of a couple of support services that we've made available to help people get the access to the mental health services that they need through the crisis. One is BH Link, which is the phone number is 414-LINK. It is run by the state. It is a hotline for adults. So if you're an adult struggling with mental health issues, don't be shy. Don't let yourself get isolated. It's real. The mental health issues are always real. They're doubly real now. So please reach out to BH Link. Bradley Hospital. I reached out to Bradley a few weeks ago and asked them if they could be like the statewide clearinghouse for children's mental health needs. They have set up a great initiative called Kids Link. It was an initiative that they had that they've expanded. So if there are any kids out there, or pediatricians, or teachers, or parents who feel that their children are anxious, depressed, scared, need access to mental health treatment, don't hold back. You can call Kids Link and they will arrange for you to access the appropriate level of mental health care that you need. The other thing is, I want to remind everyone of an executive order that I signed some number of weeks ago requiring that insurers cover telemedicine for everything, including mental health, including just phone calls. So to your point, Jim, it's extra hard on people now, and I want to make sure everyone knows you're not alone. We've ramped up our capacity to provide mental health, and it has to be covered even if it's delivered on the phone. So I'd encourage everybody to do what you need in order to get the help that you need.
In a similar theme, Christian Winthrop from Newport Buzz asks, as we all spend increasingly more time online during a stressful quarantine, what tools can you recommend to promote positive mental health and to protect children and bloggers against internet trolls and bullies to get them to knock it off?
Yeah. So a few things. What I just said would absolutely apply. So if you or someone you know or your kids are feeling extra anxious, please reach out to KidsLink and let them help you find the help that you need. I would say get outside. You know, it's so important to exercise. Exercise every day if you can. And if you can get outside every day, that would also be excellent. I know that the state police is continuing to ramp up their efforts around enforcement as it relates to online activity, which is illegal and hazardous and predatory. So we will continue to do that as well. We did a press conference for kids a couple of weeks ago, and we're going to be doing another one probably next week. So I'll try to address some of that when we do that.
Michael Bilo of Motif Magazine says other state governors reportedly asked social media operators to remove protest events on grounds they would violate social distancing rules. But government requests to private companies raise prior restraint-free speech concerns. Has or would Rhode Island make similar requests?
I haven't. Unfortunately, I haven't had to think about that. There was a protest here a week ago asking me to let the prisoners out of the ACI. They conducted that protest in their cars, so it was done in accordance with the social distancing requirements. The only thing I would say is if you protest in a way that violates the stay-at-home order, we will enforce that order. You are absolutely free to express your First Amendment rights. There's plenty of ways for you to do that. But if you show up and congregate in a group of more than 5, we will break that up and we will enforce the stay-at-home order.
Bruce Newberry of WADK Newport asks, has there been discussion with governors in the Northeastern Coalition about regional requirements or standards for interstate visitors, such as a negative test or the okay from an app?
Discussion, yes. Decisions, no. But so that's exactly the sort of thing that we're thinking about. And I continue to reference, employers that operate in multiple states. Same kind of questions for that. And we aren't there yet, but we're looking at it.
Elizabeth Graham from the Providence Business News asks, why is the state still projecting such a high potential rate of COVID-19 hospitalizations in light of a new, much lower death and hospitalization projections from the University of Washington? Is it to ensure residents stay vigilant through the summer?
No, we're not projecting anything. So many people had said, could you share with us your models? So I shared the models that we have. And I was crystal clear when I did that they change every single day. Furthermore, the single biggest factor in those models is the level of effectiveness of our mitigation of the stay-at-home order. So the models we put out last week are what they are. Our actual experience is better than that. That's why we update these models constantly. And as I said then, if everyone continues to obey the stay-at-home order, as we are now until May 8th, I fully and completely expect and hope that our actual experience will look a lot better than some of the models that we put out.
Edward Fitzpatrick of the Boston Globe asks, are all of the testing sites asking for demographic information to determine the racial and ethnic makeup of those testing positive for COVID-19? If not, what percentage of those tested do you have demographic information for right now?
As we got started with this, we were moving quickly to make sure that we had the systems that were set up and in place. And during that time, there were specific demographic components that weren't included early on. Our team was often working to even get phone numbers and really be able to make sure that we followed through, and all of that work has been done. As we have a system in place now, we are incorporating into our technology and into our process collecting of the race ethnicity data. We're going to continue to share that with you as we continue to compile that information and make sure that it is as accurate as possible.
The next question is from Nancy Thomas of RI News Today. If those over 60 are in a most vulnerable category, and you're looking at a 4, 6, 9-month timeline for complete opening, are you suggesting that this age group may be home for 9 months or more? What is your trajectory for this group, and how will earnings be replaced?
So this is all part of what considerations are in place. From a public health standpoint, we need to make sure that we are driven by science, evidence, and data, and we're still collecting that information. We do know that our seniors are the most at risk, given the demographic breakdown that I shared earlier today. And so that naturally is going to require us to be the most aggressive with protecting our most at-risk populations. Both seniors, people with underlying illnesses, as well as the communities that we are discussing as having higher rates. And we're going to need to be creative in ways to make sure that the protection of those populations is ensured as we follow the governor's guidance and leadership in safely reopening the economy as effectively as possible.
Our last question is from Ian Donis of the Public's Radio. What is the percentage of those tested who have provided their racial or ethnic data? Is this enough to draw conclusions about high incidence in Latino or other communities?
So it's an excellent question. It's exactly what we are focused on. We are still collecting the information about race and ethnic data, racial and ethnic data regarding those who have been tested. We're working diligently to pull that together so that we can compare that against those who have responded as positive and better understand what the outcomes are and the impacts are on the communities who we are seeing higher rates within. It also helps guide the proactive approaches, some of which I shared today, more of which we're looking to do in really engaging with leadership at the community level to make sure that we are responding to what's needed. Those who do need to go to work, making sure that they have the support that they need, making sure if someone does need to quarantine and isolate, how can they do that safely if they are in a multi-generational home? Or those who need to have access to services and resources for food and medicine, how can we make sure that that's in place so that every community has the resource and the capacity to respond to the measures that we know work? The social distancing measures, the ability to test as many as we can, contact trace, make sure that people are quarantined and isolated safely and appropriately, and that they continue to have the support that they need. So we will share that as we have that data available, and it's exactly what we are working on.
Dr. Alexander Scott, thanks so much. Thank you, Governor.
Thank you.